And welcome back to The Factor Uncensored. Fentanyl continues to be a top concern. Researchers have been looking at drug tests for the past 3 years. They have found traces of the drug have increased by 9 times in the western part of the country. Dr. Danish Ali is here to talk about the problem that many call now an epidemic.
Dr. Ali, I would hate to say it, and of course, this is a technical term and needs to be put out by drug czars and those who are in charge of monitoring drugs in this country. But when we think about fentanyl, it almost feels like an epidemic. It's touching every social, economic line, racial line, all across the country. It's just mind-blowing. And we're hearing the latest report. I mean, the statistics you have with you, but it's just mind-blowing just how impactful in 2-3 short years fentanyl has become. But before we start, once again, let's establish what fentanyl is and how people get it, because many people think individuals are out there going to buy, hey, let me get a hit of fentanyl. And it doesn't work that way. You get fentanyl inside of other drugs, right? Explain that to us.
That's correct, Isaiah. So this is a synthetic opioid, and what that means is that this is a medication, a drug that can be made by mixing different compounds, right? And so what we've seen is that this fentanyl compound itself is 50 to 100 times more potent than morphine itself. We already know how strong morphine is.
Yeah.
And it's very potent and very strong, and that's why very small amounts of this substance can be put into other drugs, other medications, other things to help give it that effect, that high, that resource that people are looking for in these sorts of medications and drugs. And so just that small amount can be so detrimental, and it can cause respiratory depression, and it can cause some of the effects that we're seeing on the streets right now.
And of course, we want to make sure we point out that most people, when they're getting their cocaine or they're getting their crack or they're getting their marijuana, they don't know it's in there.
That's exactly right. So this is a synthetically produced product that's very cheap to make. It can be smuggled, it can be brought in other forms. And what they do is they'll tag it along with the cocaine, the methamphetamines, the marijuana, and it gives it that potency, gives it that extra feel. And that's what, and it makes it more addictive as well, right? And so because of all of those reasons, these drugs are getting more involved in these drug dealers' hands, and so they're mixing this in. And when they mix it in, it gives it that potency, that little edge that they're looking for folks to come back and get more. And unfortunately, because of this, we've seen the effects of fentanyl in the streets.
And a recent report indicated that it has permeated the entire United States, across the everywhere.
That's correct, Isaiah. However, there's been a 900% increase in the western region of the country. So California and all the western parts of the country have seen a 900-fold increase in the amount of cases, in the amount of folks that are being tested positive with fentanyl or related deaths in those regions.
What advice would you have for family members and friends out there if they know a loved one is a drug user and they know this loved one may be buying drugs, they don't realize they have fentanyl in it? What advice would you give to those family members out there dealing with this person who may be strung out on drugs?
That's correct, Isaiah. Obviously, abstinence is key, but if they are actively using these substances, and so it's very important to have somebody that they can potentially talk to. If there's somebody that can monitor, there's some reasons why these folks are taking it. Sometimes it may be depression, anxiety, other things that may be causing them to have this addiction to this drug. So you want to try to see if you can get them help from that standpoint. Some of them deal with pain, right? And so as we know, with the opioid epidemic, it's become more and more challenging for folks to receive opioids, from their providers, from their physicians, and therefore they're going to other means of obtaining these medications. And so if you know somebody that's dealing with this and it's for pain, instead of going to the streets, perhaps, reach out to your physician, reach out to a pain management provider who has other medications, other injections, other things that they can do beyond just opioids to help you with this. So first, seek help if you cannot practice abstinence. And also talk with your physician, talk with your, if you have a psychologist or a psychiatrist that you're taking this medication because of depression, anxiety. So it's very important to talk to somebody about it. And lastly, Isaiah, there are medications out there that can help prevent some of these effects of, respiratory depression as it relates.
Dr. Ali, we'll get to that when we come right back. We'll get to more details about that here on The Factor Uncensored.
And welcome back to The Factor Uncensored. Researchers at Millennium Health say there has been a 146% jump in positive fentanyl tests between 2019 and 2022. With the addictive and deadly drug more available, we ask if lawmakers and leaders are doing more to sound off the alarm and warn the American public.
Now, Dr. Ali, when we left off on the last segment, you talked about a possible solution to help those who may be hooked on drugs. And if they get fentanyl in their system, we've seen many people. We've seen hundreds of thousands of people die as a result of getting fentanyl in their system. And there is a drug that you have been talking about for quite some time here on The Factor that could help loved ones if they see someone having an overdose, right?
That's correct. Yeah, Isaiah, it's not a solution. Obviously, the solution is complete abstinence, as it goes without saying, but there is a medication in case you notice that your loved one who may or may not be consuming some of these drugs. It's something called Narcan. This is a medication that helps reverse some of the effects of the actual fentanyl itself. And so that's definitely an option. But regardless, if you see anybody having respiratory breathing issues, or they're just laying there and you don't know what caused it, call 911 immediately. If you have Narcan at hand, you can administer that medication. But again, it's a very short half-life on that. And so just because you may administer it one time doesn't mean that you're out of the woods. Still call 911. They still need to be evaluated in an emergency situation because the half-life or the efficacy of the Narcan, it lasts for a few minutes. And so you still may not be out of the woods. Therefore, it's very important, even if you do administer this medication, to still get medical attention immediately.
And of course, we know in many parts of the country, and I think right here in Harris County and Houston too, you will have EMTs, paramedics, law enforcement officers who are equipped with it as well, anticipating seeing this situation occur out on the beat.
That's correct, Isaiah. Yeah, so a lot of the law enforcement folks have it, as well as the EMS. And again, this is not something that a lot of folks are purposefully getting off the street. These are medications, these are drugs that are laced with the fentanyl, right? So if you're, getting marijuana, cocaine, heroin, anything, it may have a little bit of fentanyl laced in that. And that little bit of amount is just enough to push people over the edge and develop respiratory depression and death from it.
Recently, you and I talked about a vaccine that the University of Houston professors and scientists over there are working on. Do you think there is hope for that? But it seems to be down the road a bit.
That's right, Isaiah. Those studies were done in rats. It has to be now emulated and repeated and replicated in humans. And so the next part of the trial will be with human folks where they're going to be doing this trial and research on. So I still anticipate at least a couple of years before we get to see something like this in the market. Obviously, we discussed the results of it and how effective it is, but right now it's not available. So, short of abstinence and short of, being very cautious, I think the key is just to have also this discussion with your providers, your physicians, and also to potentially have this Narcan on hand as well.
Now, do you think we're doing enough as a government to sound the alarm about the dangers of fentanyl? We can remember some of the 1980s PSAs, public service announcements, where it was like, this is your brain on crack or on drugs or egg frying. Should there be some sort of campaign from the government saying, this is how dangerous fentanyl is? This is why you need to be careful when you're using illegal, illicit drugs out from the streets of America.
I really do think so, Isaiah. I think it needs to be a nationwide push first, and then we need to, bring it down to the state level, the county level, because again, this 900-fold increase that we're seeing on the Western Hemisphere or Western part of this country is a very high increase. And so, here in Texas, we've also seen a 200% increase. But again, regardless, any death that can be prevented from this is one too many. And so it's very important for us to have a push. I think this is why a program like you in discussing this and bringing it to the attention of folks is so important. And I can't give you enough praise to bring this to folks' attention, and hopefully we can save lives and reverse this high number of cases that we're seeing here.
And that'll do it for us here on The Factor Uncensored. And we want to remind you to follow us on social media. You can catch us on Instagram, Facebook, and Twitter. The Isaiah Factor, also Isaiah Factor Uncensored, and Isaiah Factor. And don't forget to download the Fox Soul app. You can catch it and watch us there as well at foxsoul.tv. And of course, Fox Soul has its own YouTube channel, so check us out there and many other great programs. That'll do it for us tonight. Have a great one.